let's talk about something pretty terrifying: psychosis. That feeling of losing touch with reality. We almost always think it starts in the mind, right? But what if it doesn't? What if it actually starts in the body? That's what we're digging into today. This fascinating idea of secondary schizophrenia, where a physical illness can actually look like a severe mental one.
Yeah, that question, it really shakes up what we think we know, doesn't it? We're so used to connecting hallucinations with a problem in the mind. But just imagine for a second, what if the brain isn't the one causing the trouble? What if it's just reacting, like an alarm system going off because it got a distress signal from somewhere else in the body?
So to really wrap our heads around how this is even possible, we're going to start with a really interesting, kind of paradoxical condition. And it's one where losing your sight can actually make you see things that aren't even there.
Okay, so this condition is called Charles Bonnet syndrome. And the idea behind it is pretty simple, but it's also, wow, it's profound. It's when people who are losing their sight start having these incredibly detailed visual hallucinations. Think about that for a second. They're losing their vision, but in a strange way, they're seeing more than they ever have.
And when I say detailed, I mean it. This stuff is wild. We're not talking about just some blurry shapes. People see fully formed people, animals, entire landscapes. But, and this is the absolute key, the people having these visions know they're not real. They're fully aware there's no delusion here. It's like a phantom image, and it's happening because of a physical problem with their eyes.
So the big question is, how on earth does this happen? Well, think about it like this. The visual part of your brain is a busy place, right? It's used to getting this constant stream of information from your eyes. But when that stream suddenly gets cut off because of vision loss, the visual cortex gets, well, it gets bored. It gets restless. It's starved for something to do. So it just becomes overactive and starts making up its own pictures. It's literally creating its own movies inside your head.
And there's a name for this. It's called deafferation syndrome. All that means is that when a part of the brain loses the sensory information it's used to getting, it doesn't just power down. Nope. It can actually fire up and become spontaneously overactive. You know, we see the exact same thing with phantom limb pain, where someone who's had an amputation can still feel their missing arm or leg. It's the same principle at work.
Okay, so let's connect the dots. If cutting off sensory input can make the brain create visions from scratch, what does that tell us about psychosis in general? This idea is a perfect lead-in to a really powerful model for understanding how the brain can get pushed to its tipping point.
And that brings us to the key question, right? If losing your sight can be a stressor that triggers hallucinations, what other kinds of stressors are out there? What else can push a brain that's already vulnerable past its breaking point and into a full-blown psychotic episode?
This is exactly where a really helpful idea called the vulnerability stress model comes into play. It's pretty simple, actually. On one hand, you have a person's underlying vulnerability. Maybe it's genetic, maybe it's from an old injury. And on the other hand, you have stress. The model says that when the stress gets to be too much and it overwhelms that person's specific vulnerability, that's when the brain can be tipped over the edge into acute psychosis.
You can almost think of it like a simple equation. Vulnerability plus stress can equal acute psychosis. The main takeaway here is that it's not just one single thing causing it. It's this dynamic, this interaction between the two.
Now, it's super important to understand what we mean by stress here. We're not just talking about having a bad day at work. No, this is about major physical assaults on the body. Things like a serious illness, substance use, a brain injury, or even just not sleeping for days on end. These physical stressors, sometimes piled on top of psychological stress, can absolutely be the trigger. It just goes to show the body and the mind aren't separate things at all. They're one deeply connected system.
And once you realize that a physical problem can be the root cause of psychosis, well, that changes everything. It completely reframes how we should even think about treating it. And that leads us right into our next section, the principles of treatment.
So this really is the million-dollar question, isn't it? If the psychosis is actually being caused by a physical condition like an infection or a problem with your metabolism or an injury, then what's the right way to treat it?
And you know what? The answer is actually incredibly logical and clear. You treat the primary disorder first. Simple as that. Before you even touch the psychosis, you have to go after the underlying cause. If a nasty infection is causing delirium and hallucinations, you treat the infection. The psychosis might be the loudest, most alarming symptom in the room, but it's not the actual disease.
And this guiding principle, it's more than just a nice idea. It gives doctors a really clear, logical, and precise strategy to follow.
So let's walk through this treatment hierarchy. Step 1, and this is the most important one, find and fix the underlying cause. Step 2, and this one takes some patience, you just observe. You watch and see if the psychotic symptoms start to fade away on their own as you're managing that primary illness. And only then, if you need to, do you move to step 3, using antipsychotic medications. But you're using them selectively, just to handle any symptoms that are still sticking around.
There's a really great quote from our source material that I think nails this. It calls antipsychotics non-specific agents, and that's a perfect way to put it. Think of them like a super strong painkiller. They can definitely help with the pain, the hallucinations, and other symptoms, no matter what's causing them. But they don't fix the broken bone, right? They're a tool to manage symptoms, not a cure for the actual disease.
And even when medication is the right call, doctors have a big decision to make. It's a trade-off. On one side, you have standard antipsychotics. They do a good job managing symptoms, and the risks are generally lower. But for really tough, persistent cases, there's a medication called clozapine. It's way more effective, but it also comes with much bigger risks that mean you need constant, careful medical monitoring.
So this brings us full circle right back to where we started, with a pretty challenging question. When you really get that something as huge as psychosis can start from a physical problem, it just forces you to rethink that line we always draw between the mind and the body. It's a powerful reminder to always ask why, to always look a little deeper. And it makes you wonder how many other conditions that we've labeled as mental are really just the brain's way of responding to a physical distress signal that we just haven't figured out how to hear yet.